Over a week ago, the province announced the availability of the flu shot. For some, the flu shot is a must. For others, many questions need to be answered. So we thought we'd bring in somebody to help answer some of those questions. Chris Chu is the London Drugs Pharmacy Operations Manager. Good morning, Chris.
Good morning.
I see you brought some boxes as well, too. I'm sure you'll explain that in a few seconds.
Sure.
A lot of people are asking themselves the question, is this a personal question that maybe other people shouldn't really be asking?
Well, not really. I think everybody should be discussing this. The flu vaccine is very important as a preventative measure to ensure that you don't infect other people or there's no outbreak there. It's really important if you take care of any seniors or geriatric population or healthcare workers as well too, so they can remain at the front line if ever an outbreak occurs. And then young children as well too, obviously, because of in a school setting where they're in a closed, tight setting like that, it's very easy to pass it around at that point.
We're hearing that half of the population could be vaccinated if they so choose to. This is more than we've ever had before.
That's correct, because last year the province had 20% of the population covered, and they obviously ran out last year. So this year they more than doubled it and actually increased it to 45% of the population that can be covered. And we've definitely noticed that the government has done a fantastic job of advertising and explaining the reasons why people need it. And then obviously things like this where we get interviews to discuss a little bit further definitely helps out with the information for the public.
Yeah.
Who are most at risk? Who should definitely be getting the flu shot?
Definitely what the government aimed for is actually 100% of all healthcare workers should try to get it, just because of the nature of their work. Geriatric populations, anybody with high-risk diseases such as high blood pressure, diabetes, asthma, all those populations definitely should have it as well too.
There's a lot of naysayers. Let's be frank here. There's a lot of people who would say, you know what, I've never taken the flu shot. I continue to go down that road. How would you respond to that?
You know, and some people will continue on that way because they believe that, some people believe that once they have the flu shot, it increases their ability, actually their likelihood of getting the flu right after. And more of that is actually just might be coincidence at that point. Because after they get the flu shot, it still takes about 2 weeks before it becomes active, because your body has to remember how to fight it off. And then it becomes active at that point. So they might be more of a coincidence. Some people just get like some bad side effects. Maybe they get a little bit sore arm, a little bit of a low-grade fever as well too. And usually if they just take some Tylenol or some type of pain reliever at that point, that'll help lessen that side effect. So that's where they start making the association that that's where they get the problem from when they get the flu shot.
Chris, there's also an argument too that if you don't take the flu shot, you're building up your immunity because you are going through and getting all of the other germs in your body, and your body is fighting it off. Again, how would you respond to that?
A lot of people think that, but you know what? Year after year, it's different strains out there. So what the manufacturers do when they make this is actually they see what the top 3 strains or 4 strains that are out there, and that's how they make the vaccine for that coming up season.
And now we're not just doing the shot. Like when I was a kid, that was the only option. But now there's the mist.
Right.
How long has that been around?
Yeah, you know, that's been around for about the last 3-4 years now, and it's been a great addition to the vaccine war out there. The reason being is because there are some adults who are needle phobic. Obviously children, I have 3 kids of my own. 2 of them, as soon as I told them there might be an issue with the flu mist, do you mind getting the shot, they just started crying. So, you know, quite honestly, yeah, it's actually great to be able to have that option, and it's painless. So all they do is actually they put one shot, one spray in one nostril and another spray in the other nostril. The child inhales and they're protected at that point.
Just because you get the flu shot does not mean it's over. You can go ahead and there's still some survival tips to make sure that you keep yourself away from germs.
Yeah, that's absolutely correct. What I do, and we have our kids do as well too, is they keep a little bottle of hand gel with them. That's important just in case if you don't have access to any water or soap and water to wash your hands before eating or anything along that lines. Coughing in your sleeve if that happens as well too. And then if you're sick, just make sure you stay home until that fever is gone so that you don't spread it around to anybody else that might be close by as well.
Yeah, that never happens at work. People always
nobody ever shows up sick, do they?
No one ever does.
At what point should people be staying home?
When they have a high fever that seems to last and Tylenol isn't taking care of it, I definitely would stay there because they're most contagious at that point. Stay home for at least 24 hours. Drink lots of fluids as well too, making sure you have your water beside your desk there, and make sure that you keep up with your healthy foods as well too, like fruits, vegetables, things like that as well.
Is there a point where you should seek medical attention from a doctor?
It depends on how high your fever goes. If your fever gets really high, like above that 38, 39 degrees as well too, if it seems to last longer than that a week, elderly people as well, to anybody with the high risk, asthma, things like that, they definitely should get checked out to make sure that their disease isn't actually progressing any worse at that point.
But right now, you're also saying not to go to the hospital if you're feeling the first signs of it.
That's correct. Yeah, you don't want to actually increase the amount of people in the emergency department just over a flu. You definitely want to stay at home, like I said, just drink lots of fluids, take some of your pain reliever, fever reducers, give it those 3-4 days, and then if it's still there, then definitely check with your physician, your family doctor at that point.
And if you're getting the flu shot, consider a pharmacist as an option of where you can go and get it done.
That's correct. Yes.
You don't have to make an appointment?
You don't have to make an appointment.
Okay.
Definitely for our stores, what I suggest people do is actually give us a call before they come in, just to make sure that we have the coverage so that we can actually give you the time to actually inject you properly at that point. We did have specific days as well too where we're just doing the flu shots. So if you go to our website, londondrugs.com, you'll be able to see all the various dates and the locations that are administering the flu vaccine just on those particular dates and time. And you can call to make an appointment on those days, or like I said, you can definitely call our stores anytime if you have availability right now to see if we can walk in and actually help take care of you at that point as well.
Chris, some great information. Thank you very much. Chris Chu is the London Drugs Pharmacy Operations Manager. By the way, there's a lot of things that are happening in and around our city as well, too. It's the Calgary Girls Choir. They are pleased to present the Sopranos Concert featuring guest artist Caroline Schiller. It is this Saturday at Christ Church. If you'd like more information, there's the information, www.calgarygirlschoir.com.